everyone, and welcome back to my YouTube channel. Today's Thursday, so it is the day that I am getting my face lasered. I'm really excited. Right now I am just on my lunch and I am fixing to go into my sister's place of work. Like I said, she is a licensed cosmetologist. However, she does not do hair. She does professional body waxing here at a place called Brazil's Waxing Center. She is the best for waxing. She is fixing to hook my eyebrows up because they are getting a little bit out of control. So yeah, just stay tuned. I'm gonna let you guys meet her, and then we will get to the fun part in just over an hour and a half. I'll be getting my face lasered, so stay tuned, and that is coming up next. Alright, so we are fixing to walk into Brazil's right now, so just stay tuned. Hello. Yes. So I will just wait on her. She running on time today?
She is.
Good.
She is.
Alright, so we are here. We are in the room. Fixing to get my brows waxed. Just show you guys a little bit of where I am. It's just a waxing center. Hi! This is my sister.
Today is not a good day for this.
Me either. We don't ever wear makeup here. We live in Florida. It always sweats off.
Not to work. Not to work. Not to work.
Alrighty.
Eyebrows today, darling.
Eyebrows.
Well, let's make them pretty. Tell me what you want.
You know how I like them. Perfect. So did I tell you I'm getting my face laser today?
Yeah. Oh, yes. You did it before, right?
Yeah, I've had one treatment. It's been a little while, over a month.
I'm getting bad breakouts. Did you head back a little bit? Close your eyes.
Well, that's why I'm doing it. For the acne scars.
Yeah, my face is... Didn't work out a whole lot.
Alright, so I just left getting my brows waxed and they are red. So later my whole face is going to look like this, so just wait. It is hot as hell in Florida. It says it's 88 degrees, but no, there's no way. No way. And I know I have a jacket on, but I'm cold nature, so when I'm at the office, it's always freezing, always freezing. So I always have on a jacket and I never take it off, just because this shirt always gets so linty. And lint rollers, I mean, we go through them. We go through the lint rollers. So yeah, if you guys want to donate some lint rollers, we will take them. Everybody at the work, at my job, will be very grateful. But yeah, so I'm just heading back to work, fixing to just eat my lunch there, and then about 1:45, I'll be getting my face lasered. So I can't wait.
Does it have to have more than that?
No, just enough to make contact, yeah.
Okay.
Is it on? Is it on?
Mm-hmm.
Yep, okay.
So then you just touch it,
Yep, and it'll make the beep sound. Yep,
and then you go on to the next one?
correct. And it takes an average of those three. And now hit that button again, and it'll transmit it. And then it came up here. So her average is a 15.
Okay.
I think that's what I was last time too.
Yeah. And then you look here at what group that is in. So you're going to be a 2 to maybe a low 3. I think I would say you want to go up here. So then, because we're doing the GMAX, like this, so we'll barely see you. Okay.
That's wonderful.
Very ready.
And so that's where all the new skin cells are going to be formed, and collagen and elastin is going to come out of, right?
And the crust.
Right in the crust. Okay.
Alright, so now that you guys have seen my before and after pictures and that you have seen kind of how the laser works, I'm going to talk a little bit about it, like my personal experience, how it went for me. Sorry, let me pull that up a little bit. Okay, so basically it is not the most comfortable feeling in the world. However, before you get this laser done, we do highly recommend that you get numbed. So there is a picture in this video that you see me with my numbing cream. It's a medical grade numbing cream. It has 3 different types of numbing agents in it. It is very strong. We use it a lot for fillers, people who get lip injections or fillers in their cheeks or anything like that. So it is really strong and it really does work. So I applied it all over my face. We leave it on for about 25 to 30 minutes. After that, it's really not effective anymore. So once I feel like I'm pretty numbed, which I was, I got in the bed, or not in the bed. I'm really tired if you guys can't tell. I got on the little bed that we sit on, and then we got started. So basically she wiped all the numbing cream off. You also seen her put some solution on my cheek, my forehead, and my other cheek. She used this little, it's a little reader that reads your melanin type, and it has a ranking system. It's kind of really detailed, kind of hard to explain, but basically it tells what level of melanin or pigment that you have, and based off of that is what settings that she puts on the laser so that she doesn't burn my skin. So good for that. So basically the first one that she did is called a GMAX, and it's a lot more painful than the other one, which is a fractional. It's either a 1540 or a 1040. I can't really remember right at this second. But that GMAX, it is not the most comfortable thing in the world. So my forehead, for some reason, hurts the worst with that. Let me scoot back a little bit so I feel like you guys can't see me. So my forehead hurts the worst with the GMAX. It's just really sensitive, and I asked my boss why that is. She says because our cheeks and the rest of our face have a lot more fat or cushion, so to speak. Our forehead is just really bone. So with that laser, it was really uncomfortable for me. And it was a little uncomfortable on the rest of my face, but just the forehead was, she didn't do more than one pass on my forehead because I just didn't want to do it again. But the second laser that we used, the 1040 fractional or the 1540 fractional, I can't remember. Sorry, guys. That one is my favorite. That one is specifically for scarring, which I told you guys that I needed the most on my cheeks. Sorry, my cat is fixing to freak my dog out. So that laser is my favorite. She didn't do it on my forehead because I didn't really need don't really have any scarring on my forehead. It's just mainly on my cheeks, which you can see are really red. She used that fractional laser on me. She went over it about 2 or 3 times. That one is not so bad, actually. That one is more like a little pinch almost, and is very, very quick. I mean, it goes away very fast. The pain isn't not really existent as the GMAX was. Okay, sorry guys. Go, sit, sit. You want to be in my video? You have to sit down. Sit, and you have to calm down. Sit. Thank you. All right, and then, so yeah, she went over a couple passes with that laser, and that's really what I needed, because I need my acne scarring to go away. I hate it so much, so she did that for me. It feels like a sunburn. It is really tight almost, like my skin feels like leather right now. It's really sensitive to the touch. Like I said, it is just like a sunburn. That's what it feels like, to be completely honest with you. Immediately afterwards, we applied an aloe solution, and then I used a sunscreen, which is required. So if you're leaving the office or going out in direct sunlight, sunscreen is required. We use a brand at my work. It's called Ulta MD. It's a really good brand. I really like it. This one is tinted, so I didn't use this one after my treatment. I used a clear, like a white sunscreen, and it's an Ulta MD brand. It's a white sunscreen, and it's really good for acne too. So, but this one is just a tinted. I'll show you guys. Everybody knows what a tinted sunscreen looks like, but it's just tinted. So I'll be using this from here on out, because I don't want to go anywhere without sunscreen on my face, especially with it being so exposed after this laser treatment. It's really not a good idea to not to go out without any sunscreen on. So I will be wearing my sunscreen. So with that being said, my experience was really good. I mean, just like the first one, I knew what to expect. So I knew it was going to be a little bit uncomfortable, a little bit painful, and now I'm just going to recover from it. So I'm going to be red for the rest of today. I'm probably going to be swollen tomorrow. Definitely going to have sensitive skin tomorrow. Don't get in my camera. And then in a couple of days or so, I'm sure I'll start having some brown spots pop up that are going to start flaking off. But other than that, I will give you guys an update in a couple of weeks, kind of like a recovery update, to let you know exactly how my skin is doing. All right? Thank you guys for tuning in. If you are interested in following my life, my journey, I start school next week. So next week I'm going to have a lot of videos about my introduction into all of my classes that I'm starting. Just subscribe below. Like this video, comment on it, let me know what type of material you guys would like to see, because I would really like to do other videos with y'all, not just schooling videos. So let me know what you guys are interested in, and yeah, I'll see you guys next time.